Hi, Robert.
Hi, hello, how are you?
I'm well, thank you.
Thank you, nice to meet you.
Hi,
I
Cindy.
would like to, thank you. I'd like to welcome the folks to, I'm not sure exactly what number COVID Talk this is. We've been doing it for a while. The good news is that we keep doing it. The bad news is that we keep having to do it. But I want to thank everyone who's participated in the past. It's been both reassuring to our community to know that we have this wealth of expertise in our midst, and to get relevant and useful information. Just a couple of notes about things going on in the community. The CSD Book Club will be having a meeting toward the end of August. The book will be The Color of Law, which addresses issues of residential segregation and how that's impacted American society. So keep your eyes open for information about that. And without much further ado, I'm going to pass it back for formal introductions to Dr. Huck and to Susan. Thank you.
Thanks, Robert. So just a note of facilitation tonight. We have two technical facilitators, my dear friends and community advocates, Michele and Michelle Masaccio, and they'll be doing the muting and monitoring of the chat. So we will probably get to chat questions as the evening progresses. So let me now introduce both Cindy and Dele. Cindy Hawk is the chair of family medicine at UCI. She has devoted her career to promoting health equity and increasing access to primary health care for disadvantaged populations. Her research includes the design and evaluation of disadvantaged populations. Her research includes the design and evaluation of medical education and family medicine programs, preparing physicians for work in low resource settings, doctor-patient communications, gender equity, social accountability in medical education, integrating clinical medicine and public health, and health advocacy and community engagement. And I can't tell you, Cindy, how honored I am to be here with you with that background. And Dr. Dele, and now I'm not going to be able to say it right. Ogunseitan.
You practiced, you can do it.
As University of California Presidential Chair, Professor of Population, Health and Disease Prevention, Director of Education, University of California Global Health Institute, Director of Workforce Development, Institute for Clinical and Translational Science, and Director of Training and Empowerment, USAID One Health Workforce, Next Generation. Again, incredibly impressive, and I'm so grateful to be with you. So we have come from having a conversation about what the needs and questions of our University Hills friends and neighbors are, to having a real discussion, I feel tonight, about global health and the pillars of what the One Health Project is. So as I have done in the past, I will ask you to reflect on your week or weeks, and what you're learning, what you're understanding, what you're feeling and experiencing. Cindy, can you go first?
So first of all, I'd just like to say how happy I am that Dele was able to join us tonight. He's a dear friend and a fabulous colleague and a great leader. And so I don't want to speak too long because I want you to hear more from Dele. But at any rate, I will just say that the COVID situation is a perfect example of a global health challenge. In fact, it's one of the biggest global health challenges in our lifetimes, and certainly in my career. I think HIV/AIDS would be a close second, or maybe first, because certainly more people have died from HIV/AIDS. But, you know, I compare HIV to COVID as like HIV was quietly creeping
Slow.
along slowly. And the way we, you know, it's transmitted is through body fluids. And so this is a very fast moving train, and it just hit us by surprise, and it engulfed the entire world. And I can't wait to hear more from Dele, his perspectives on it. I'll just say, bringing it home here to Orange County and our own practice at UCI Health, we've certainly felt the surge in increase in number of cases here in Orange County. We have many patients in the hospital, in the ICU. We've had to reconfigure our clinics and our health system to deal with this surge. Fortunately, so far, the surge has not exceeded our capability of being able to handle. But unfortunately, we've had close to 700 deaths in Orange County, including many today. And these deaths and the severe impact of COVID, unfortunately, it's fallen on those people who are most vulnerable, the elderly, those with comorbid conditions, and particularly communities who are living with low incomes and crowded conditions, and are more likely to contract the disease and less likely to be able to isolate. And so we're seeing really continued increased spread in certain communities here in Orange County, particularly in Santa Ana, where I'm working, and in other communities where people don't have the resources needed to really protect themselves or their families. And so again, I want to thank each and every one of you for being here tonight. I feel so blessed to be part of the University Hills neighborhood and community. And I've just seen so many examples of people here looking after one another, wearing masks, taking measures to physically distance, to wash their hands, to do those things that we know can make a very big difference in the transmission rate. So thank you for that. And I'd love to hear more from Dele.
Thank you, Cindy. We're very grateful for you. Very grateful for you and the work that you're doing with the community and in these populations. Dele, I'd love to hear from you.
Thank you, Suzanne, and thank you, Cindy. UCI is blessed to have done something to attract you to to our campus, and I remember our initial meetings when we heard that you're coming, and the excitement was boundless. So, and so when I also saw your leadership in this forum at the very beginning of the pandemic, before we didn't expect anything like this, but at the time it was, you know, hearing about far distant places and hoping that we will escape. But thanks to all the work that you're doing, I think hopefully we'll be spared the worst of the worst. And Susan and Herbert, thank you again for your leadership in this community. I think it just feels more and more, it's always been home. I've been living in Uni Hills for 20 years, working at UCI for a little bit over 30 years. So I've known a lot of people. I've been mentored by a lot of people. Neighbors have come and gone, but the character of the place, it's really a global village in a local situation. So I appreciate that. So, you know, I was trained in microbiology for actually since undergraduate, master's, and doctorate levels, but mostly bacteria. I worked in the initial phases of understanding how bacteria exchange genes. And we were very fortunate to have a job at a university where you can always add skills to what you do. So I wanted to learn public health, and I went to get a master's in public health, and I started collaborating with people who speak the language, and slowly you get grants, you teach, and you learn more. And I see this community forum as also an opportunity to learn. So there are questions that will be posed. I have my perspectives, but I also know that there are wonderful, talented people in our community who can enrich the discussion by sharing their perspectives, and I will learn just as much from participating as I hopefully will be able to impart. So I just very briefly, when I started the USAID project, we were very excited. We were going to start in September 2019, just a few months ago. We were all worried about antibiotic resistance as the next big global health topic. And it fell into my lap as a, microbiologist who was interested in how bacteria, do their thing. But, soon after we started, obviously, we were beginning to hear stories about this new infectious disease in Southeast Asia. We work in 8 countries there. We work in 8 countries in Sub-Saharan Africa. And we got into the middle of the first year of a 5-year project, and everything changed. All the plans turned to COVID, not only because USAID had to be responsive to what they're doing, but we also have on our team expertise that had worked on this kind of spillover, we call them. And they've worked in China. Some of them have been in the news in the last few months because our president decided to pull their fund from NIH. So I've been lucky to have a very strong team, across the country, across the world, to use their experiences to think about how we're doing, how a global health situation can spiral. And despite the knowledge that we have built up in the US, I find myself really reversing that role, that we have so much to learn from other countries that are doing well, relatively speaking, and thinking, what have we missed? As Cindy said, there was a big surprise, but we thought we were very well prepared. We were going out to teach other people how to be prepared. And so it's a big surprise, but the lessons that we learn hopefully will prevent the next one. So Susan, I think my 5 minutes of introductory remarks are up, and we can go into the questions.
Thank you. Thank you. That's a really helpful perspective to understand how you got to this and how as recently as October began looking at this. So with COVID, we've heard about the transmission of the pathogen from bats to humans. How do these diseases get from one species to another? Can you help us understand that?
Yeah, it's an excellent question. And the term we use is spillover. How do these viruses spill over from their reservoir hosts, which are typically wildlife, through some kind of environmental medium? It could be water, it could be food, it could be air, into human populations. Unfortunately, viruses don't really care what the species is. They just want a nice cell to infect that will be a factory to make more viruses. I studied bacterial viruses for my PhD, and at the time we were debating, are they really alive, or are they just some kind of chemicals that can, but the, advent of molecular biology and, some of the DNA viruses, the RNA viruses, clearly it's been a fine-tuned strategy to survive and to proliferate. And it's matchless. And so the spillover events are typically when humans encounter viruses that have the ability to either through mutation, change their selection for a particular type of hosts, and they can then begin to proliferate in human cells. We used to think that species that are close to humans, like the primates, are the most likely sources of spillover events. But I think we've realized, actually, from rabies, dogs to humans, that spillover events have always been with humans, and we've managed to sometimes use them to our advantage. So, for example, the cowpox is similar enough to smallpox that people understood many, hundreds of years ago, that you could vaccinate somebody with cowpox and they will not get smallpox. And this was Edward Jenner's accomplishments, built over decades of work from China, parts of Europe. But the milkmaids that were milking cows didn't get smallpox. And they figured out why. Is because the viruses are similar enough that they would get some immune response, which was protective. So sometimes it's beneficial. I've been watching the listserv this week for our University Hills, and I can't but help alarmed but very interested in the conversation around West Nile virus. Okay? This is another major One Health outbreak that we hope it's going to be limited. But the West Nile virus was first detected in a woman who got really serious fever in Uganda back in 1937. Sometime in the 1990s, it came to New York City. In the zoo, they had some crows and some bird species getting sick and dying. And somebody smart figured out that it's not the virus they thought it was. It was this new virus that's never been in the Western Hemisphere. And it was the West Nile virus. And since then, it's moved west. Now we have it in California. And this morning in Uni Hills, on the listserv, somebody said there was a dead crow, and they needed to know how to report it to the California Department of Public Health, because there's a website that you can go to report dead crows, dead squirrels. And there is I think somebody found that there is a mosquito that's been shown to have the virus in Uni Hill. So we all have to be vigilant. One Health is not something out there. These spillover events occur regardless of what pandemic we're dealing with now. Other spillover events are happening. And our responsibility as a community is to be vigilant. It won't always be in faraway places like China or Africa. It can happen here. And the environment is the medium, but any virus can actually spill over if the mutations are right and the host conditions are right.
So
go ahead.
Well, Dele, I just wanted to mention this idea of One Health that I think is so beautiful. Really, it's this concept that the health of people and animals and the environment are all linked together. And in fact, we can't separate our health from that of the environment that we live in. And of course, animals are so important, and either as vectors or as supporters of human life. And so I think that concept of One Health is really a beautiful thought. And it really, the COVID situation kind of, again, brings it to light, because we know that COVID probably came from animals to people. We're not exactly sure what animal or how it happened.
Yeah.
Do you have any idea? Do you have a better clue now of where it actually came from?
Yeah, so on our team, there is the group that I mentioned earlier. It's Eco Alliance, and you may have seen them in the news. Peter Daszak is their leader. We meet every Wednesday with USAID folks, and they had worked for a long time in China, trying to map out all of the coronaviruses in bat populations, not just in China, in Indonesia, Vietnam, Thailand, where we work, and also Malaysia. And the reason NIH pooled their funds is because they thought that EcoHealth Alliance had somehow worked with the lab in Wuhan, China, and that somehow it was not a natural spillover event, but a cross-contamination event. Peter and EcoHealth Alliance deny this, of course, but they do have a project to map all of the viruses like the corona, SARS-CoV-2, that they know is present in bat populations. This is not a new thing. We knew that SARS, almost 20 years ago. So it was kind of predictable. We just didn't know when or whether we'd be able to curtail it. Now, there were reports that the wet market in Wuhan, that they sold bats for food or medicine. That evidence is actually slim. And then there is another possibility of an intermediate host between the bat and people, and that's a pangolin, which they do sell in that wet market in Wuhan. There is a, excuse me, a beautiful documentary movie about pangolins and their scales. It's called Eye of the Pangolin. If somebody wants to go watch it, it's not long, but it's won awards, because I didn't know much about why people would go after pangolins and go trap them and bring them to market and people. So some of it is medicine. So for bats, it's food, especially the fruit bats. I grew up in Nigeria, and we had really large populations of fruit bats, I think across West Africa and Southeast Asia. And so it's not surprising that people use them as food. They're typically hunted in West Africa. In Southeast Asia, there are, just like you would have a pig farm, you would have sheds just to cultivate bats, and it's just like an agricultural thing.
Wow.
But if you don't have the kinds of inspections that will keep animals safe from transmitting pathogens, it's a matter of time that somebody will get sick. Just like FDA here, you eat lettuce, one day somebody's gonna get sick. It's a well-developed process, but it's not 100% foolproof. So the best guesses are still bats, because we know in the wild population of bats, this virus occurs. But we still don't know for sure if that's what happened in Wuhan. I'm more inclined to think about that intermediate host.
So, Dele, there is a question about these wet markets and whether or not they should be banned. But I'm hearing you say there's also a cultural component to what One Health does.
Oh yeah. So it's a very interesting question about banning wet markets, and when I first thought of it, of course, it makes sense that certain animal species that are well characterized, that they should be monitored very carefully. Almost all of us, I'm sure all of us, have been to wet markets. In fact, when I think of farmers market at the the church behind Uni Hills on Saturdays, you could buy meat, you can buy vegetable, you generally don't go there to buy, wild things. But a wet market is really a place you can buy fish, you can buy, caught meat, and some of them are well run. But One
I don't think
Health,
I've ever seen pangolin there, but still.
yeah, you won't find pangolin right in our neighborhood. Yeah, but One Health thinks about what we call ecosystem services. In places where people go hunting and bring one or two species to that market, those are more dangerous because there's no regulation about where they got it from, who buys it, how they treat it, cook it, and if the conditions, the environmental conditions in the wet market are not up to par, it's a recipe for disaster. I know there have been stories about Wuhan and people hosing down bloody and animal feces into the same sewage system. uh, and it's a fast moving place. It's one of the largest in the world, I think. It's just difficult. And so I think ecosystem services, if we ban things like that, we might drive some things to the underground. And that's even more dangerous because you can't regulate them. So I would call for more regulation. I think what China has done in May is to ban bats from Wuhan market for meat. They don't ban it for medication. Um, and so it's a little bit of a piecemeal regulation. I would rather see a more comprehensive international forum that talks about how to implement this in places where people still depend on wildlife for nutrition. In some parts of Africa, it's called bush meat, and people will, you will drive around on the highway and somebody will be hanging a stick with their fresh catch. You have no idea what species this is, except that they assure you it tastes good. So, there will always be one-on-one trade like that, but where they are concentrated, they are alive, they're defecating, they're butchered, those places need to be tightly regulated, not to push them to the underground, because it will. The pangolin documentary, you'll see how much underground market there is. It's shocking.
That's it. That's an excellent point. So to your point about policy, public health researchers for years have warned about this pandemic and the potential for the pandemic, but policy has not kept up. How have these policies and concerns not been heard? How could they not have been heard?
I think they've been heard, but ignored in some cases. There are different levels at which policy can help the One Health framework. So at the international level, there was actually some traction. The World Health Organization, the Food and Agricultural Organization, and the World Federation of Animal Health. I think it's called OIE because it's a French French roots. I can't remember how to say it in French, but it's OIE. That tripartite have been very active in One Health for quite some time, and they've been pushing international policies to address what they see as a looming disaster. A lot of their work did focus initially out of the SARS and the MERS outbreaks. Camels were the sources of MERS in the Middle East, but also bird flu. If you remember the avian bird flu, that I think at some point we called it the Mexican flu, because people are always trying to figure out where did this come from.
Yeah, but the Mexicans found out what it was. It wasn't their flu.
Yeah, exactly. I mean, 20 years later, we're having, is it China virus or but I think the policies were really about regulating trade. Typically, you want to be able to stop something before it gets out of the border. But the landscape keeps changing. People travel more. And so by the time the data from the epidemiologists get to some central location and the countries affected clamp down, people are spread out. And that's what happened in this case. China may not have acted too quickly. It was interesting in contrast to, avian flu, where there were clear attempts to hold on to the data because of trade and tourism considerations. So we need to address those things, that there is no incentive to keep a country from keeping a secret about an outbreak that might be a spillover. We just can't have that. Margaret Chan, the former director of the WHO, was very popular because she did fundamental changes at WHO. I think she was Minister of Health for Hong Kong or something at the time. And everybody saw that she was very effective. And there was a lot of reform at WHO. There needs to be more, but this is not the time to pull out from WHO, in my opinion. That tripartite, FAO, OIE, and WHO need to keep pushing for One Health. They are also doing a lot on antibiotic resistance. Antibiotic resistant infections, as I mentioned earlier, was kind of what everybody was afraid of before COVID, which means we would lose all of the successes we've had in common infections that nobody ever wants to suffer from. But the United Nations, for example, the only time they passed a resolution on a topic like this was the resolution to combat antibiotic resistance in 2017. All countries came together and said, we're going to go and adopt this policy, no more antibiotic use that's used in human populations, in hospitals, as well as in agriculture, right? Because that was a problem. In the US, we actually use more antibiotics in agriculture than in hospitals. And so the FDA came with a list of antibiotics that will not be permitted to be used in agriculture anymore because we need them for humans. So there have been sort of top-down policies that have either met with some resistance at the country level. When other countries adopt certain policies, others drag their feet and because they are thinking more about the economic impacts. And I think it's all on us to advocate that the cost of responding to a pandemic like COVID far outweighs anything you will spend in preventing it. I mean, it's just unimaginable, the difference. And I think this is a big lesson for governments that always try to save money by not working to prevent disease, that it's just so much more cost effective to spend that money ahead of time on those policies and enforce them than to suddenly deal with trillions of dollars in response. That's a long answer to the policy thing. But
well, let me just reinforce Dele's message, because I think that the United States has, for the last several decades, really underinvested in our public health infrastructure. We've kind of taken it for granted, whereas a number of other countries who have much lower incomes and GDPs as compared to the US has really put a lot of effort and resources into building a more robust public health system. And those very countries have done such a better job in dealing with this pandemic than the US, where, we've basically had every county and state out for themselves, competing against each other to get PPE or testing or, even the basic things that are needed to control a situation like this. We don't have the infrastructure in one of the most wealthy countries in the world to deal with something like this. And, we knew that that was a problem, and this pandemic has really brought that to the fore. And sadly, we have one of the highest rates of infection and death of any country in the world. And shame on us because we haven't done the work we needed to ensure a robust public health infrastructure.
We are no
Thank you.
longer leaders.
Yeah, that's a very important point Cindy make, because we took it for granted that it wouldn't happen here. Um, yeah, another policy that I would mention is after the Ebola outbreak, the world came together, didn't like the response, and we agreed through the World Health Organization and other agencies to establish the Global Health Security Agenda. I was spending a year in the Department of State when we were hosting one of the ministerial conferences. And part of the Global Health Security Agenda is that every country does a joint evaluation exercise where you invite experts from outside to look at your public health system. Are you going to be ready? And the US was among the first countries to do that. And they pointed out some of these inadequacies, except we didn't follow up. We didn't do anything with the report.
Right.
And it is unfortunate that we now spend so much money, and yet it's not as effective as it would have been. On PPE. I mean, these are things that we should be sending out to other countries, and we were fighting over it. Anyway, it is. Hopefully it won't happen again if we now take it very seriously, that just gloves, you have to be ready. Even if it's a little bit more money to stockpile them and they expire, it's worth it, right?
Yeah, well, that all comes down to the issue of leadership, and
Next question.
it would be going well past 9 o'clock if we got into that this evening, as tempting as it is. But Dele, I'd ask, Susan sent me some of these questions, and I was just, to follow up on this, I sent her this, which was, following up on the policy issues. We have increasing skepticism and we have suspicion of scientists by a lot of people in this country, especially, but also in other countries, and also with leaders. I mean, we can speak of several specific ones, but the One Health approach, and I was reading about this today. I have to say, I was really impressed, and loved what you had there on the site. And it's an ideal situation that we can do this. But I mean, coming back to this, I'm sorry, I'm
it's okay.
Leaving the script here. So what is the likelihood, I guess, is the question, given these caveats, what is the likelihood that the One Health approach will actually be able to have an effect and increase its impact both in the USA and worldwide?
Yeah, thank you. I think the likelihood is higher now than it was a year ago, only because the evidence is clear that we can't just respond, we have to prevent. And you can't prevent by just having a focus on human health alone, meaning that you only worry about the seasonal flu that we already know, right? We have to be ready for things we don't yet have, but can be out there. And that's the reason to go out and survey, bat populations, pangolins, and water systems. A lot of the One Health discussion that emerged over the last 20 years, I think there is interest in thinking about environment in a broad scope, including climate change. How will climate change affect new diseases that we may know them, but they've never been a problem for the US, like malaria or Zika, where mosquito populations may change according to climate. Should we go back to spraying DDT as we did to eradicate mosquitoes when we established CDC? And there are debates about this. There are healthy debates, but we know so much more than when we started using DDT before it created another massive environmental problem. We know better how to control mosquitoes. We can use genetic tools. Every solution will have caveats, but we can make those decisions.
You're basing these decisions on the issue that there is a basis that we look on scientists and say, you know, this is the truth, and we base it on that. Whereas what we're seeing in society, you know, here in the UK and to some extent
Brazil,
yeah.
yeah.
Brazil, yeah, great example with Bolsonaro, that they are science deniers. And then there are the anti-vaxxers when a vaccine actually comes along for COVID-19. You know, my question is, how does your organization deal with the people who, you know, need more persuasion?
A
holistic approach.
I brought up the climate thing because I think the public understands the nature of deniers and uncertainty with climate. Only because, you know, economists think about discounting future events, because we were talking about climate as in the future, you know, 50 years from now, the models were talking about things that people didn't really feel connected to. And I remember in 2004, I wrote a paper on using health as a way to get people to worry about climate change. Because in many cases, the health outcomes are more immediate, right? If you say, well, you don't have to wait 100 years, you know, to get your 2 to 4 degree rise in temperature to get a big flood or agriculture fails, but that these diseases are here now. People encroaching on ecosystems and cutting down trees and forests. Those things will have an immediate impact on health. So if you are clear cutting, as it happened in Brazil, which is an easy case to make, the rainforest and burning and pretending that it's just because of economics, the impact will be not too far in the future, not easy to discount. So one health approach is really to make these connections clearer for people. It's not that the deniers will not continue to deny. If a few of them are converted by the argument that we're all connected, you cannot make money cutting down the forest and not pay for it in healthcare. I think that case is being made now. There was a tremendous focus on get back to work, get the economy going again. But then we're seeing the, you know, cases and mortality mount up, and it's our money. It's the people's money that will go to these things. And a wise policy is to really think about that paradigm, um, and figure out that it's a smaller investment to connect these dots. Uh, I think we're getting past the point where it's ever going to be cheap to address climate change. Ultimately, it's going to be very expensive to prevent the damages that will be done. The same thing with the surveillance that we have on things that are not yet affecting human health in all those forests, all those rivers, that if we don't keep those surveillance programs going, the outcome will not be affordable. So I think for those who want to prioritize economics, we can make the case to them that it's cheaper. But the denying of the scientific evidence, I think there's a religiosity to it beyond any reason. It's just about, you know, I don't remember what day of the week it was maybe it was 2 weeks ago. The the announcer or the what do they call the person who deals with the press from the White House said something about we shouldn't let science get in the way. Okay,
Oh, yeah.
well, you can't argue with that because it's not about, you know, the priority of economics or human health or behavior or international trade. It's just that I'm not gonna believe it no matter what you say. I do think education will help sort of phase out these kinds of attitudes. And I wrote something when this pandemic started, because I firmly believe that we should start global health education in grade school, not just because we're having to explain to kids where does this pandemic come from, but there's a little bit of just general education that's needed, so that even when the deniers try to talk about scientific uncertainty, children understand that uncertainty doesn't need to paralyze you from making decisions. And the scientific evidence is still the best way we have to support those decisions. So, you know, I think when we have the general population educated enough that people who become you know, reporters for the White House or having positions where they can speak to large populations, that people understand when it's not the right attitude to have and they can see through
I
it.
just love it, Dele, that you've been here over 30 years and you're still an optimist. It's wonderful.
I will never give up.
So Dele, I want to ask you a question of like, how do you keep your hope for the future? What is it that keeps you going?
Because I have two young, they're not young, they wouldn't want me calling them young anymore. I have two daughters that we talk about this regularly, and I understand their fears. I don't think any one of us can really understand it. Yeah, you know, we're a generation, some of us, our parents, the World War, there have been periods of despair. But I think on this scale, just because of being overwhelmed by news, uncertainty, being sheltered in place for so long. And I want to give them hope. And I have to believe in me that it is not just a fluffy rhetoric, right? That I really believe that beyond my lifetime, there will be solutions on the traditions that we grew up on, you know, scientific evidence translate to policy, and that there will be creative people in that next generation who will think beyond what I'm capable of. But it is hard to convince them that this is worth doing. But I just can't imagine the alternative. So I first convince myself and then I talk to them. Yeah.
That's beautiful.
I like that.
Thank you. Cindy, did you want to speak to any of those things? I'm hearing, you're saying that you believe that there will be less and less people who accept who accept the inconvenient truth. There will be people who will be rethinking that inconvenient truth.
Yeah, and not gobble up everything they, you know, hear from one source or one, you know, medium, TV, radio.
Education is key. You're absolutely
yeah, because they know when they're being tricked. But you have to be educated in the basics to be able to critically think about such things. And it's not just the US. I think this is global. Tanzania, where we work, they have a leader who also doesn't believe in the numbers. And instead of believing the number of cases, would rather fire the health minister. I mean, it's and people in that country have to be able to say, okay, I hear you, but I'm still gonna wear my mask. Yeah.
Cindy, your thoughts?
I scratch my heads about the concept of science denier. For most most people in modern society, we drive cars, you know, so cars are like combustion engines that are based on scientific, you know, engineering principles. So much of our modern life is possible and capable because of advances in science and inquiry. And the fact that there could be people denying that is just, I don't know, I find it really hard to reconcile. But I do think that there are trends within our society that are saying we don't really look at the evidence to weigh and carefully analyze what's going on. And so, again, that's part of why I feel so fortunate to be part of the University Hills community and an academic community in which, you know, we're constantly searching for improvements in our understanding of how the world works and what we can use to actually improve the situation for humans and hopefully for the animals and the environment, because we know it's in our own enlightened self-interest to understand these complex processes so that we can use this information to make informed decisions and move forward. So that's the beauty of an academic community, and all of you who are here listening tonight, you know, wondering what's going on and what can we learn and how can we contribute to make the world better.
That's great, Cindy. Thanks.
Very well said.
Mm.
Michelle, do we have anything that we want to add from the chat? Michelle Masaccio is helping with the chat tonight.
Yeah, thank you,
no.
Michelle. Yeah.
Oh, thank you. Thank you for being here, Dele. No, I have seen nothing come in the chat. So only, you know, I am inventing ones. I have plenty of questions, but
Go ahead, Michelle. Let us have it. Yeah.
No, I mean, there's a basic public health perspective one, and then of course an existential one. So I'll start. I really just, are we really seeing a typical once in a century pandemic event that we can expect at that pace? Or are we really entering a new phase of accelerating, you know, spillover origin and globalization mediated epidemic?
Great question.
I think if your next question is existential, then it's existential squared, because this is this is just as tough. No, we don't. There are lots of people working on modeling One Health scenarios, because that is the question. My fear when we just started seeing the numbers for COVID-19 go up in every country is that there will be an overlap of another spillover event. And then, you know, we have two raging pandemics, which is not impossible.
Mm-hmm.
And so, I mean, it's helped a little bit because we're sheltering in place. But, you know, already people are worried about the overlap between COVID and the seasonal flu, but there could be another thing. And so your question about, are we entering a phase of higher frequency of these kinds of events? Anecdotally, I know those models they're still working on them, and, you know, there will be uncertainties and error gaps and things. But if you just think about it, you know, the human population, despite the pandemic, you know, we're fast approaching, I don't know, 9 billion. You know, maybe it's a silver lining that we haven't traveled as frequently as we used to, but with a rapidly mixing population growing, you know, exponentially, with resources being depleted, ecosystems being compromised, it makes sense. It's not going to be one-off. And that's the prediction, is that there will be, just like they predict, you know, more frequent floods and hurricanes. It's the same thing with this kind of spillover events.
But with this thing, I might just point out that leadership is everything. I mean, if you have educated wise leadership, then when something like this comes up, then you wouldn't have the leadership of China keeping this quiet. And then you wouldn't have the leadership of other world countries here in Brazil saying it's nothing.
Yeah.
Thank you.
It makes a big difference. Whether it's 1 or 2 per decade, certainly in the last 20 years, we've seen, things that are either on their way to become real big pandemics. Now we have this one, but I fear that it's not going to be the last, and we need to put people in those leadership positions who are not going to, just thumb their noses up at things.
Dele, that's a good point. Thank you for bringing that back around. We could have done another hour on that subject. Michelle, we have 5 minutes.
Existentialism, let's hear it.
I know.
It's actually maybe hopeful, but basically, I think, and this comes a little bit from your insight of how you tried to connect, looking at global climate change and global warming, and with respect to, how do we sort of triangulate there? How do we really see that all of these things impact us? And so basically, it's a general question. It might be helpful, is can we learn from this pandemic about how to regard each other in society? Is this are there going to be practices that we can draw from this to maybe improve some other societal issues? Is there a spillover into
Perfect last question.
It is excellent, and it will be something we'll all sleep on and chew and hopefully come up with shared resources. There is a new group being assembled at UCI called Solutions That Scale. And it's a cross-disciplinary program. I think there's a website which I can share later. But physical sciences, social sciences, public health, biology, everybody's trying to do something that can help us take lessons from this. I think the question really is about the scale of events that will need us to not just rely on, if I wish we could have a playbook of lessons from the 1920s flu that, suddenly, we read it and we prevented this one, but that's not what happened. We have to be more willing to learn from different societies, different institutions, and different problems. We will increasingly confront risk factors that are global. That's just the nature of a limited planet with a lot of people and with appetite for resources. So I think global climate change, global pandemics such as COVID-19, we need solutions that that work as much as we want it to work in our uni hills, Irvine, but also somewhere else where they may not have the scientific infrastructure to come up with those solutions, but that we know how to implement the evidence that we have that something works. Even things about mask wearing or social distancing. We had a forum on, best practices in, 15 countries, and it's very different. And yet we're all reading the same scientific papers. Sweden, for goodness sake, is doing a different experiment. So solutions at scale might help us. And this has been such a challenging year with the civil protests, and there are just problems that are going to grow in scope and scale, and we need to be able to share best practices and learn from one another. I just I believe that. I know that we can be distracted by focusing narrowly on our own house or neighborhood, but in many ways, most people around the world face the same questions that we're talking about tonight. And so, Michelle, it's not the perfect answer. I hope we'll continue that discussion at, at some point. I know it's 9, so thank you again.
That's a beautiful answer. A beautiful answer.
Cindy, is there anything you wanted to add to that?
Well, I will just follow up on a comment that Dele shared earlier, that the health of any one of us is connected to all the rest of us. And I think that this pandemic has really brought that to the forefront. And so hopefully we can learn from that and perhaps even vote for and elect leaders who understand that, who will enact policies that will enable us to bring some of the solutions to scale so that all of human life and animal life and our environment can thrive, into many generations in the future. So
Educated leadership, I'd go for it.
Thank you, Cindy. You've just been inducted to the One Health Hall of Fame. All of you.
That was beautiful.
Thank you so much. I'm going to go watch The Eye of the Pangolin.
Yeah.
All right, yeah. I'm going to watch the full movie.
Thank you.
Thank you and good night. And
Okay,
thank you so much
everybody.
for organizing and listening. Okay.
Yeah,
Thank you all. Thank you all.
Bye-bye.
Thank
Bye.
you, Susan. Thank you.
Bye.
Okay. Thank you.
Thank you.
Well, you could do some stretching.
No, it's not even that. It's just